Welcome to NSG 229, Study Session 4, Stages of a Child's Developmental Process and the Child as an Individual. Introduction. Have you seen a baby before? You were once like that. Our lives were formed from within our parents. You grew up to be what you are today because you have undergone the process of growth and development, which moved you from one stage to the other. This study will discuss the various stages children go through during the developmental process, the normal expected milestones for each stage, and the child as a unique individual. Learning outcomes. At the end of this study session, you should be able to 1. Describe the stages of growth and development of a child. 2. Explain the child as an individual. Stages of growth and development of a child. All children go through a normal sequence of growth, but not at the same rate. Thus, the rate of a person's growth and development is highly individualized. However, the sequence of growth and development is predictable. In general, there is correlation between physical growth, mental, emotional, and social development. Knowledge of developmental milestones provides a base for planning and implementing holistic, individualized nursing care patients and their families. The stages include parental stage, fetal or embryonic, from conception to birth. The prenatal development of human beings is viewed in 3 separate stages, namely germinal, conception through week 2, embryonic, weeks 3 through 8, fetal, week 9 through birth, neonatal, birth to 28 days, infancy, birth to 1 year, postneonatal, infancy 1 month to 1 year, require high level of care in daily activities, toddler 1 to 3 years, preschool, early childhood 3 to 6 years, school-aged, late childhood 6 to 12 years, adolescence 12 to 20 years, young adulthood 20 to 40 years, middle adulthood 40 to 65 years, older adulthood 65 and above. 4.1.1 Prenatal stage. The average length of time for prenatal development to complete is 38 weeks from the date of conception. During this time, a single-celled zygote develops in a series of stages into a full-term baby. The 3 primary stages of prenatal development are the germinal stage or the pre-embryonic stage, the embryonic stage, and the fetal stage. A. The pre-embryonic stage. Conception occurs when the female egg ovum is fertilized by the male sperm. The genetic material of the sperm and egg then combine to form a single cell called a zygote, and the germinal stage of prenatal development commences. This stage lasts about 3 weeks. The zygotic implant in the uterine wall. Implantation marks the end of the germinal stage and the beginning of the embryonic stage. B. The embryonic stage. The embryonic stage begins after implantation and lasts until 8 weeks after conception. Soon after implantation, the cells continue to rapidly divide and clusters of cells begin to take on different functions, called differentiation. It occurs from 4th to 8th week. There is rapid growth and differentiation of the cell layers take place. All basic organs are established at the end of this stage. The fetus is vulnerable to any factor that might cause congenital abnormality. The process of differentiation takes place over a period of weeks with different structures forming simultaneously. Some of the major events that occur during the embryonic stage are as follows. Week 3. Beginning development of the brain, heart, blood cells, circulatory system, spinal cord, and digestive system. Week 4. Beginning development of bones, facial structures and limbs, presence of arm and leg bones. Continuing development of the heart, which begins to beat, brain and nervous tissue. Week 5. Beginning development of eyes, nose, kidneys, lungs. Continuing development of the heart, formation of valves, brain, nervous tissue, and digestive tract. Week 8. Beginning development of hands, feet, and digits. Continuing development of brain, heart, and circulation system. Week 7. Beginning development of hair follicles, nipples, eyelids, and sex organs, testes or ovaries. First formation of urine in the kidneys, and first evidence of brain waves. Week 8. Facial features more distinct, internal organs well developed. The brain can signal for muscles to move. Heart development ends. External sex organs begin to form. By the end of the embryonic stage, all essential external and internal structures have been formed. The embryo is now referred to as a fetus. C. The fetal stage. Prenatal development is most dramatic during the fetal stage. This lasts from 9 weeks to 40 weeks. All body organs and systems continue to grow and develop. When an embryo becomes a fetus at 8 weeks, it is approximately 3 centimeters, 1.2 inches in length from crown to rump and weighs about 3 grams, 0.1 ounce. By the time the fetus is considered full-term at 38 weeks gestation, he or she may be 50 centimeters, 20 inches, or 3.3 kilograms, 7.3 pounds. Although all of the organ systems were formed during embryonic development, they continue to develop and grow during the fetal stage. Examples of some of the major features of fetal development by week are as follows. Weeks 9 to 12. The fetus reaches approximately 8 cm, 3.2 in length. The head is approximately half the size of the fetus. External features such as the face, neck, eyelids, limbs, digits, and genitals are well formed. The beginnings of teeth appear, and red blood cells begin to be produced in the liver. The fetus is able to make a fist. Weeks 13 to 15. The fetus reaches approximately 15 centimeters, 6 inches in length. Fine hair called lanugo first develops on the head. Structures such as the lungs, sweat glands, muscles, and bones continue to develop. The fetus is able to swallow and make sucking motions. Weeks 16 to 20. The fetus reaches approximately 20 centimeters, 8 inches in length. Lanugo begins to cover all skin surfaces, and fat begins to develop under the skin. Features such as finger and toenails, eyebrows, and eyelashes appear. The fetus becomes more active, and the mother can sometimes begin to feel fetal movements at this stage. Weeks 21 to 24. The fetus reaches approximately 28 to 5 centimeters, 11.2 inches in length, and weighs approximately 0.7 kg, 11b.10z. Hair grows longer on the head, and the eyebrows and eyelashes finish forming. The lungs continue to develop with the formation of hair sac, alveoli. The eyes finish developing. A stator reflex develops at this time. Weeks 25 to 28. The fetus reaches approximately 38 centimeters, 15 inches in length, and weighs approximately 1.2 kg, 2IB.1100Z. The next few weeks mark a period of rapid brain and nervous system development. The fetus gains greater control over movements such as opening and closing eyelids and certain body functions. The lungs have developed sufficiently that air breathing is possible. Weeks 29 to 32. The fetus reaches approximately 38 to 43 centimeters, 15 to 17 inches in length, and weighs approximately 2 kg, 4 IB, 0.6 OZ. Fat deposits become more pronounced under the skin. The lungs remain immature, but breathing movements begin. The fetus bones are developed, but not yet hardened. Fingernails have grown past the tips of the fingers. In a healthy fetus, all organ systems are functioning. Generally, prenatal stage is characterized by development of all significant body systems. Also, inherited factors, maternal health, and age have significant influence. Nursing implication. Mothers should be educated on what to do to prevent abnormality by providing suitable environment for fetal growth. Neonatal stage, birth to 28 days. 4.1.2 Neonatal stage, birth to 28 days. In the first month of life, babies usually catch up and surpass their birth weight, then steadily continue to gain weight. A weight loss up to about 10% of birth weight is normal in the first 2 to 3 days after birth. However, the baby should have gained this back and be at his or her birth weight by about 2 weeks. While all babies may grow at a different rate, the following indicates the average for boys and girls up to 1 month of age. As the nervous system begins to mature, these reflexes give way to purposeful behaviors. Nursing implication. Assist parents to identify and meet their needs. 4.1.3 Infancy. A newborn's shoulders and hips are wide. The abdomen protrudes slightly, and the arms and legs are relatively long with respect to the rest of their body. 1 month to 1 year birth weight triples and length increase by 50%. Physical growth is rapid at this stage. Average weight male 10 kg, female 9.5 kg. During infancy, a great deal of initial learning occurs. This learning is provided through environmental cues, such as parent behavior. Very basic skills are mastered during this time period, such as crying, nursing, coordination, and the ability to represent images and objects with words. Nursing implication. The infant's environment should be controlled in order to meet physical and psychosocial needs. The child as an individual. 4.2 The child as an individual. The child is distinct from his or her parents. Each child is a unique being who is different from every other human being with a different combination of genetics, life experiences, and environmental interactions. The type of family in which the child is reared, their ethnic and racial background, religion, social status, the type of food they eat, pattern of living, and their attitudes towards relationships with others. Children differ in rate of growth, ultimate size, capabilities, ways in which they respond to the environment. 4.2.2 Individual differences in growth. Each child grows in his or her own unique and personal way. There is great variation in age at which developmental milestones are reached. Measurements are usually defined in terms of ranges to allow for individual differences between children. Some children grow fast, some moderate, others are slower in reaching maturity. Personality differences are also allowed. Relevance in nursing. Nurses need to understand the individuality of each child in order to provide quality care, help child attain, maintain or regain an optimal level of health, provide appropriate stimulation and intervention, counsel, and provide information to parents. Two, the child is distinct from his or her parents. Each child is a unique being who is different from every other human being, with a different combination of genetics, life experiences, and environmental interactions. Nurses need to understand the individuality of each child in order to provide quality care. End of study session 4. Thanks for listening.